Okay, so doing Optimus's anal gland expression, we know forklift hold is going to be our best method of restraint. He has peanut butter on the wall because he's very wiggly. He loves to wiggle a lot, especially today. Overall, it's going to be a good distraction for him. And he does have a nice history of anal gland expressions that need to be done frequently. It's not always going to be the same per dog on who needs their anal glands expressed when. Sometimes it's like every 4 weeks, every 8 weeks, every 6 weeks. It's all independent on that overall time frame. So I have all of my materials I need. I have appropriate lubrication for him. I have my gloves. I have my paper towel to catch any potential secretions, if he has any at all, as well as I have my spray that I like to use, Bedhead. This is for dogs. It's blueberry muffin shampoo, but it works really well for this, to clean up his perianal region afterwards. So when my restrainer's ready, I will get started. You ready, restrainer?
Yes.
And his Optimus's back end needs to come more towards the restrainer to be straight. Okay, so as we go to perform, I'm going to talk to my restrainer. All right, performing. And I will have my paper towel with me. Index finger, gentle insertion, center of the anus. Ooh, he does need them expressed. We know that his anal glands are located at 5 and 7 on a clock. I'm going to begin expressing his left anal gland by looking at it. If you can see, it's a little bit thick right here. I'm also pushing it outward, but I just want you to see it. So I'm going to milk it kind of like a grape. Ready? Mm-hmm. And it is expressing appropriately. We're not going to squish it really hard. That can cause severe irritation and discomfort, especially if they have an anal gland complication. So expressing it, his left anal gland was full. Its overall appearance, within normal limits. We know it can be a brown tinge color. So I'm gonna go ahead and express the opposing side. Are you ready? Mm-hmm. Good boy, Optimus. So I keep my finger within his rectal region. I'm not gonna remove my finger and reinsert. That can cause potential discomfort. I'm just gonna do a gentle 360 on that. And I'm gonna move my body with it, because that works best for me. You don't have to, but if it works best for you, you can do that. Ready? Mm-hmm. This one is full as well. 1, 2, 3. Mild expression like this. Milking it, the grape slightly. Good boy, babe. Good boy. Good boy. I know. See, he's uncomfortable because it's quite full. He just had his expressed probably a week or 2 ago. We know they express them most of the time normally when they defecate. However, sometimes they can have epithelial cells get in the way of that. So his opposing side, his right side, was normal as well. So I'm gonna go ahead and do a brief rectal palpation because I'm already within the rectal region. Why not? He definitely has to defecate. Everything feels smooth, rectal-wise, or rectum-wise rather. I know, baby, good boy, a good boy. Restrainer, you good? Mm-hmm. 360, I don't feel any nodules, bumps, any concerns, except for he needs to defecate. So bringing out my glove, I see his feces just a little bit, so I observe the color and consistency. This is normal for him with his particular diet. There are no parasites, blood present, anything like that. I'm also going to remove my glove because it's covered in anal glands and debris. I need to clean his anal region, so I need him to turn back around. Optimus, look at the peanut butter. Here. So I spray this directly on here onto the paper towel to clean his back end. Some dogs are very uncomfortable with you spraying something directly on their anal region because it's cold. I'm gonna clean. You ready? Mm-hmm. He's a good boy.
Good boy.
So I'm just gonna gently wipe around the region, remove any potential residual anal gland secretions. Both of them were he was bilaterally full with his anal gland expression, both were within WNL, within normal limits. No abnormal characteristics. The normal pungent odor is present, where it smells like very nasty fish, which is normal for anal glands. If they were infected, could that potential odor change? Maybe, but typically it still has that nasty fish smell. If he had blood present within his anal glands, potentially it would smell more like iron. But overall, he is all set and good to go.